Yeah. Hello. Welcome back. Okay. So in looking at continuation, so now we looked at what is the pathology. This is sort of the very basic summary of what happens when there is an aggravation of vata. So typically we understood this Shaya of how that increases vata. That's ideally what we looked at earlier in your training. But one other aspect of how vata increases is also vata avana, or the blocking of vata. Okay, so this is when, especially when you come into the pathology side and you're looking at disease, it's important to decipher if it's either that one or this one. Okay, and then that's what determines what your course of action will be. Okay, so if we can just quickly go through the functions of the subdoshas of vata. And you guys, most of you know this already, so I just want to kind of quickly go through it. Of course, here in your notes, under the first page of Vata Vyadi, you have, why is vata important? And we've talked about this before, vata being the force or the factor that causes the other doshas to move. So the other doshas cannot move. They are considered paralyzed without the presence of vata. Vata is what helps to initiate the other doshas, their functions, to get them to move from one part to another. So therefore, vata is very, very important. Okay? So in Charaka, he's given a slightly more detailed description than what we typically know for the functions of vata. Some of these one of, just quickly to go through again, promotes all types of actions such as inhalation, etc. It restrains and impels the mental activities. So here he's directly giving you the correlation between the mind and vata. So in one of the vata functions itself, it also helps. Remember we were talking about patience of the mind. What is patience? Patience is basically restraining the mind from acting according to its stimulus. So you can help in restraining the mind also with the help of vata. Okay? So vata helps to restrain mental activities or mental reactions, as well as it can also push the mind excessively. Okay? Of course, it helps to coordinate with the sensory faculties and the sensory functions, and also helps in enjoyment of sensory outcomes. It causes compactness of all the tissue elements of the body. So compactness means like what we were describing. When you have something that is snigdha, that is soft, that is supple, and you have vata, what vata does is vata dries it out. And by drying out process, it creates it to become compact, right? Same thing like if you have butter and you expose it to wind, it can dry out the butter and get it to become more hard and more compact. That's here again the description of how vata creates the compactness of the tissues. All of the tissues when we talked about dhatu parinama, we talked about nourishment of dhatus, we talked about how they're nourished and they're circulating throughout the shrotas, right? So they are immature in that process when they're circulating. The way they become mature, they become compact, and they actually form a tissue with the help of vata. Vata helps to then dry out that extremely moist or unstable nature of it and creates it to become then compact or sturdy or hard. And that's how you end up getting these well-formed, compact tissues. Make sense? Yes? No? Of course, it helps to promote speech. It is the origin for touching sound because those are both the sensory perceptions that are related to Vayu and Akasha. So therefore, of course, Vata is made up of Vayu and Akasha. That's why it is in very close relation to touch and sound. And similarly, it is the root cause for auditory and tactile sense faculties. It is also one of the causes, root cause for courage and joy. And the reason here is you're looking again at the very close relationship between Vata and the mind. That's why it helps to, it has a quote, it is an initiator, the root cause for courage and for joy. Of course, stimulates the digestive fire that we know. It throws out waste from the body that also we know. It creates the gross and the subtle channels, which is the shortnesses, because of its anutva, its minuteness. So even in the minuteness of the mind, remember, Vata also has that minute quality. So it also has the ability to travel in all the tiny little spaces. So with the help of this movement of Vata in the formation of the body, and when the body is being nourished and progressing, like for instance in childhood, all of some of these other shortnesses are being formed at that time. The actual formation of that is carried out through Vata. Okay? It molds the shape of the embryo. Again, similarly here, Vata is drying out, but Vata is what's helping to create the actual shape. Yeah.
So as Vata is drying out, I'm not quite sure in the formation of the tissue, I see how it gets harder, and I definitely see how it gets subtler. How is it getting harder or more compact than the other stuff?
In hardness, it's becoming compact.
Right. But I guess I never pictured like Shukra as hard or Majha as hard.
Not necessarily hard, but well formed. Because you have the immature formation and then you have the well formed. Same thing like as the sthayi and asthayi dhatu. Remember, in the dhatus that are being formed and nourished, you have the already well-formed dhatu, and then you have the immature dhatu. So what Vata does, it helps to cause that transformation or that maturing of the immature dhatu to become a mature dhatu. And a mature dhatu is one that is well-formed. So that's how Vata helps to create that compactness of even the Shukra dhatu. For it to get its, whatever the form of Shukra dhatu is, for it to reach that compact, full, matured state of Shukra dhatu.
Not that it's necessarily more
hard
than Vata or Vata.
That's why they use the word compact and not hard.
Okay, thank you.
Welcome. And of course, it is indicative of continuity of lifespan. So if your Vata is controlled very well, then you can live for a very long time. Of course, you need Vata to live because Vata is, again, relation of Prana. You can't live without Prana. But if you control Vata, in fact, that is still one of the major functions. In the paragraph here, longevity in life. If Vata functions normally in its normal pace and track, it induces longevity. It's when Vata is uncontrolled and aggravated that it takes away from longevity. So Vata is one of the causative factors for longevity. If it is normal and happy and controlled and doing its normal function. When it gets aggravated is when it takes away from longevity. Okay? You see that? So again, why Vata is so important. Okay? So again, typically locations of Vata, pretty much common, we know this. Located in the Pakwashaya, in the waist and lower back, in the thighs, in the foot or feet, the bladder, ears, and skin. And this is the reason I put this in here is because a lot of the conditions that we're going to be looking at manifest here. When you have the typical pure Vata conditions, it tends to first manifest in its own place. So that's why I wanted to make sure to put that in there. So though you know this, it's easy for you to refer back.
Yeah.
Oh, well, that's why it's happening here, because this is where Vata sits. This is its place. Okay? So, the Vata subtypes, Pranavata, of course, located in the head, and it moves downwards to the throat and chest. It attends to the functions of maintenance of intelligence. Because prana, remember, prana. It helps also in the functioning of the sensory organs. So you see here, even though they're talking about Pranavata, in the function here, Ashtanga, they don't exactly first say respiration. First, he talks about intelligence and sensory functions. And why is that? Because those are actually looking at the closeness and the functions of the mind. So prana, you can say partially that the functions of prana, pranavata, and the functions of the mind are almost the same. They interlap with each other. But it's not the only function. Their prana also carries out some other functions that are not necessarily the functions of the mind. But you can see the overlap now. Functions of the mind and functions of pranavata are very similar. Some of them are actually the same thing. Okay. Of course, maintenance of the heart, of course, the mind, and arteries and veins. And it also carries out functions such as expectoration, sneezing, belching, inspiration, expiration, and swallowing of food. And those are the ones that we typically know. So again, some of the classical texts, it's good to look at other texts because sometimes they give you that added snippets of information. And when we look at that, then in the perspective of looking at disease, it starts to make more sense. That's why I'm reviewing this one. Okay? Next is Udanavata. So Udanavata is located in the chest. It moves to the region of the throat, and the nose, and the umbilicus, here. And what it does is, if you're looking at it this way, it's the diaphragm, basically. And it attends to the functions of producing speech, physical movements, valor, strength, color, and nourishment of the tissue. Its mental functions, Udanavata is the one that helps in mental functions, such as Ki, Vritti, and Smriti, and also Mano Bodhana, which means awakening of the mind. So this is again another reason why you do chanting. In this process of chanting, you can help to awaken the mind. And what the chanting is nothing but the Udanavata, right? So here also, so this is, remember I was telling you that Vata itself and all these subdivisions of Vata is not exclusive. They're all sort of continuations of the same Vata. And why we can say Vata as a whole very much similar and parallel with the functions and the movement of the mind. Because in each one of these descriptions, there's some mental function involved in it. It's not separate, or there isn't an inclusion of the mental function, right? So that's why we're saying there is an overlap. Okay, so the next is Vyanavata, and Vyanavata is of course located in the heart, moves all over the body, responsible for circulation. It moves all over the body with great speed. This is the one where it tells you specifically, Vata moves and it has to move all over with speed, with a specific rhythm in motion, okay? It attends to functions such as movement, expansion, contraction, upward movement, downward movement. Also this expansion and contraction, that one as well. Upward movements, downward movements, opening and closing of your eyelids, yawning, perceiving of taste of food, clearing and widening of channels, causing the flow of sweat and blood, bringing the male reproductive tissue into the uterus. That also is one help. Apanavata helps in the expulsion of it. Vyanavata is the one that pushes it. Okay. Separation of nutrient portion of food after its digestion. Again, what we were talking about. Sada and Pitta, and the Asthai and Sthai dhatu. Okay. And supplying nourishment to all the dhatus in the proper order. Okay. Next is Samanavata. This one you know pretty well. We did a lot of extensive work on that one. Samanavata is located, of course, near the digestive fire. The stomach, it kindles the digestive fire and moves inside the large intestine, small intestines, and the stomach, and the channels of the doshas, the malas, shukra, adhava, and ambu. Ambu is another synonym for jala or for food. Okay. It supports all the above mentioned functions, and it's responsible for specific functions such as retaining of food in the GIT, digestion, separation again here, And we looked at, remember we looked at the difference in different levels of separation of essence of food and waste of food, and each and every process of how it's digested and how it produces these byproducts. We looked at all of that. And also moving of waste downwards. Okay? And the last is Apanavata, and that's located in the rectum. And it moves, oh sorry, there's a V missing there. It moves along the urinary bladder, pelvis, penis, scrotum, and groin, and attends to the following functions: elimination of fecal matter, urine, semen, menstrual blood, and penis. Okay? So that's what we look at in all of the normal functions of the different subdoshas of Vata. So again, typically as a review, so you know, because right after this, we're going to look at actual disease conditions of what happens when Vata is active. And when we start to describe this, then it should start, oh, that makes sense. Oh, I see this. Oh, now that I understand. So what causes an aggravation of Vata? We just talked about how it gets aggravated according to these two conditions, and what can cause the aggravation, or what can cause the Vata to actually start to increase. Intake of dry, cold, or less quantity or light food. So that makes sense. And what would that do? That would cause Dhatu Kshaya. Excessive sexual intercourse, also Dhatu Kshaya. Frequently staying awake at night. What does that do? Induces dryness. Remember we talked about this yesterday? Induces dryness. Inappropriate therapeutic measures, which means, for instance, if you're doing Shodhana or you're doing excessive cleansing, that also we talked about. So now you see it's starting to come together a bit. Of course, administration of therapies which induce excessive elimination of doshas, including stool and blood. So even in that, even in the venesection, if it is too much, it can cause excessive of nutrients, and then Vata increases again. Okay, excessive fasting, of course, excessive swimming, excessive walking, exercise, and other physical activities. Here again, specifically depletion of the dhatus, elimination due or excessive emaciation due to worry, grief, and chronic disease. Not just the factors that would physically cause dhatu depletion, but also the psychological factors that will cause dhatu depletion. So for instance, if someone is really worried, remember we talked about this as well? If someone is eating the most healthy food in the world, they have the best Agni in the world, they're eating the proper quantity and quality and everything, but if they are affected with worry, grief, and anger and these other emotional issues, that will also affect how the food is digested. So here, emaciation due to these emotions, like worry, grief, and or chronic disease, also can cause aggravation of Vata. Sleeping on an uncomfortable bed. Again, uncomfortable bed usually refers to something that is uneven. So a bed that is uneven, lumpy, that doesn't give you the comfort. That is an uncomfortable bed. Or sitting on uncomfortable chairs. So not just a regular good comfy chair, but again, an uneven surface, or that which, the reason why, if you look at the uneven surface, what that does is Vata is constantly moving inside of your body, right? If you're putting pressure on one part and not necessarily putting pressure on the other parts, that hinders the flow of Vata, and that's how it can aggravate Vata. So, for instance, those of you who were sitting before, when you're sitting on the floor for 2 hours continuously, got up and all of a sudden started to feel a little bit of discomfort or stiffness or pain, what that's indicating is the initial signs of aggravation of Vata. That is a Kshaya symptom. Remember when we talked about the Kshatriya Kalas of the 6? Kshaya is a mild, tiny little bit of increase. That's what you were experiencing. You sat for a really long time. It's not strong enough to produce anything. It's just you feeling some discomfort, but it's not, the minute you walk, it goes away. So it's a mild increase because you were sitting in an uncomfortable position for a long period of time. So that mildly aggravated Vata. Walked it off, it subsides. Okay? Same like if you sit, you cross-legged for a really long time, your legs go numb. That again is a mild increase of Vata. Numbness. Can't feel it. So what you've done is you've blocked the movement of Vata. That's why you get that numbness. The minute you walk and the block is removed, Vata moves again and the numbness goes away. So that is a Chaya, example of a Chaya. Mild increase that immediately goes away. Okay? So this is what they talk about. Yeah?
Can I go back to number 5, administration of therapies? I have a lot of clients from school functions, but that be considered therapy, especially for increased activity that is taking.
Yeah. If it's done excessively. If there is a reason for them to have the stool softeners that they have stools that need to be taken out. And if, like for instance, if they're constipated or they're on antibiotics and that's why they're taking this so that they can get their stools moving out, then not necessarily. If they're taking stool softeners when there's no need to take stool softeners, then yes, it is excessive and that will cause it's excessive movement of Vata. So yes.
The other question is, why has swimming being picked out as an exercise?
Swimming because it's both cooling and it's an exercise. Both factors. You get the cold factor from the water, and also you get the fact that you're exercising. So it's a double whammy of cold and exercise, cold and movement. That's why it can aggravate Vata. And that's not just a little bit of swimming, excessive swimming. Yeah. And of course, anger or stress, because these are again emotions that cause an immediate increase of Vata. Okay.
I don't know. She's at the vet. I don't know. We have to go back and forth to have her intubated. Her larynx was kind of paralyzed, and evidently it's something that happens to older dogs. The muscles begin to go, and this has been going on for a while. She's been panting a lot and having a hard time breathing. She's 12 years old. Her hips are going. The whole story, but the extra heat just kind of put her over the top because dogs can't to cool down. So they have her intubated and they have her sedated so that this is relaxed and now there's oxygen back and all, but we don't know if she'll make it once she can come off. So 4 o'clock we'll see. Hopefully she'll come home, but if there's a $2,000 surgery, of course, and it happens in older dogs, but at this point, it's not really. So they can give her these sedatives that relax her so that it'll open up and she can breathe, and I could manage her, for a while that way. But it's just so hard, she's already so old. So we may have to make decisions. You can all want to do a chant? Yeah. Were any of you in my class with the bear that attacked my dog? None of you guys were. This was I forget which class it was. So it's whatever one isn't represented here. It was a weekend. Fadi Walsh was teaching. I was home. I was coming home and see how to go. Tucker, our other dog, seeing one, the other pair that I'm carrying out, he's younger. He came home, and he was definitely distressed in but he was very skittish and he wouldn't touch him. This was like 11 o'clock at night. And so I said, got him in the house. I said, listen, just as soon as we're up, we'll take him down to the vet. He wouldn't even let us touch him, anyway. So I had to get to school, and George and the kids were going to take care of it. And somebody got up and opened the door, and Tucker took off because he was like totally stressed, and he disappeared. And so the kids call me, Mom, we can't find him, he's gone. We knew that he had been injured, and there was a little blood that we could see, but so I got to class a little late because of all this, and then the kids called as soon as I got there, and I walked in, just kind of told the class, and he said, well, we all have to chant. So everybody chanted, and after the chant was over, we had taken a break, and one of my students, who was very conservative, she was actually a medical doctor, she came up, she said, this has never happened to me. I'm just going to tell you. And she said, while we were chanting, I saw a vision, and I saw your dog. I saw a broken down building with a lot of light coming in, and a table, and he was under the table. And our greenhouse is falling down, and we had tables in there. And I called the kids up, and I said, go up to the greenhouse and call him there under the table.
Oh.
And they pulled him out, and they got him to the vet, and he had been completely raked by the, almost down, down the bone in some places. It didn't hit any major organs or anything. It was kind of a miracle. But everybody, that's what happened. He survived. So we did. I think we did the midterm diet.
Yeah.
Just do a few rounds. After doing it all the way home.
It's for Sunday.
Another story for Sunny. This is another funny story. This was probably 6 years ago or so. My daughter and I took Sunny out for. We went for a hike. We got some hills here, and we went on this trail we really like. And the day didn't start off really hot, but it sure got hot. And Sunny is a very furry yellow lab. And we brought water and everything, but we got to the top, and she was fine. We gave her water, and then halfway down the mountain, she just collapsed, completely collapsed at heat stroke. And I had cell service, and it's like a Saturday, of course. And I called the vet and said, oh my God, you gotta get her down here right away. She'll die. Yeah. So we were that way, she's big dog, there's no way you can. So Leland took off, and we have some rangers, park rangers, and the ranger station may have been a mile away, and Leland was where I am. And she made it to the ranger station, and a couple of young guys were there. Meanwhile, I had all the water. I had a few little towels and things with me in a backpack. I kept soaking the towels and drenching her, fanning her, and the whole time I'm doing that. Whole time. And, and in the middle of this, my phone rings. And it's a call from India. It's Dr. Chauhan. It's just like calling out of the blue just to check in. It's like mountain. And I started telling him about what was going on. He didn't really have much to add. I said, I get done right now. It was surreal.
Oh my.
So I keep chanting. I put hands over her and water and going like crazy trying to make a fan. And the sun was starting to come through the trees and shine on her. I said, oh shit, I don't want more sun on her. So I dragged her outside. And when I moved her a little bit, she's a very happy, lively dog, always wagging, wants to jump up on me, but she can't do it anymore. And she starts moving a little bit. Good. And I was, thought it'd be a lot easier if you stood up and I moved you to me dragging you. And so she did, and then she sat down, and that was fine. By the time the Rangers got there was two young guys. Leland, she was up and she ran over to them.
Oh,
So I called it that, and this is a beautiful trail by a pond, and I thought, well, she loves to swim. I'll take her to the pond. I'll go down. I called her that and say, well, she's up and she's moving around pretty happy. And they said, oh, you better get her down here. It's bad. It's bad. I said, really? You know, she's like, you know, that, you know, I said, can I just, if I take her over to the pond, I can cool her down more quickly. I said, well, that's probably a good idea. Get her down here right away. So I took her to the pond. She went in and she got wet. Got her back in the car. Drove down to the vets. Walked into the vets, and she's running around. I said, well, where's the dog? I got the Easter. So she's just very resilient. But also, you know, the Mitranjaya is really, you know, to let go, whatever it is, whether she's holding back or whether, you know, there's something in her that we can open up and let go, whatever it is. But it's my chant, and I've used it many times for situations like this. So we can do just 3 rounds of it. Some. Om Triambakam Jamahe Surantim Pushivardhanam Vadavarukrivavandanam Mrityo Shiramamrita Om Triambakam Jamahe Surantim Pushivardhanam Om Triambakam Yajamahe Sugandim Pushtivardhanam Varvarukamivavandanam Mrityormukshiramamritam. Veronica, I'll probably get the lead in a while. And if you don't mind, you can stop the recording at the break, but you don't have to turn it off. And then just start up the recording. That way, come on. And I don't know what's going to happen, but it's to be funny.
we just made them.
Where did that come from?
It's mine. Oh, so it's already.
Okay, so that helps.
I was thinking maybe we could put some oil. Yeah. I was giving one of my other students. She does Abhyanga and all for her dog. She does massage and she says they love it. Like they'll come and lie down and they'll pick up their foot. The oil and massage their legs. Have a lot of bottom that's fine ones. Maybe that'll help them. May not help with the okay. So, what again aggravates Vata? Sleeping during the daytime aggravates Vata. So here we're looking at a different aspect. And it's not sleeping during the daytime usually would cause Dhatu Shaya. But what it does do is it blocks the channel. Remember? So here again, that indirectly, Sarika is telling you that this is one other method also of Vata getting active. So sleeping during the daytime does this sort of reaction, Shota Rota, and that therefore causes vata to aggravate. Fear causes excessive movement. Suppression of natural urges, that actually is one aspect again of Shrutaruta, because the vata is already moving out and you are suppressing it from moving out. So you are willfully stopping that movement of vata. So that's how that can then aggravate vata. Okay? Formation of ama, again, because that does this, Shrutaruta. Or avoiding food, which does the opposite, which will cause depletion. Trauma or injuries to the marmas. Trauma, what it does is, it can indirectly cause dhatu kshaya, but initially the actual action of trauma is this. It causes a disturbance in the flow of vata, which is very similar to this. What's happening here is blocking or stopping the movement of vata. The trauma does the exact same thing. It blocks or it hinders the movement of vata. So that's why it can also. So that's the condition where beating would aggravate vata, or also if it's been caused this way due to something else, beating can also pacify vata. Okay. Or injury to marmas, because what are marmas? Marmas are places where prana is at a higher concentration. That's what marmas are. It's where it's pinpointed and it's very concentrated. That's why they have more amount of little, they're like energy spots, right? Marmas are places where there is concentration of prana. Prana is concentrated at these marma spots. That's why if you activate them, you're activating the energy of the prana that's there. And some marmas are bigger than other, or has more amount of prana than other marmas. That's why they have like the heart. Or like the bladder is another marma that is, you have to be very careful with how if you're compressing that or if you're activating that, because it has a huge amount of prana that sits there. And if you activate it the wrong way, it can cause very serious problems. Same with the heart. So injury to these marmas, of course, can aggravate vata. Riding over an elephant, camel, of course. And I put in bull riding because when I was reading this reminded me of like, well, who practically really rides on an elephant or a horse? Maybe horse a little bit, but nobody really rides on a camel. But what they're indicating is riding on an animal that is uneven and it's excessive. And there are people who do this bull riding. So that is an example of an activity that actually will aggravate vata, because it's an uneven seat, it's uncomfortable, and it's excessive movement. So that's why it aggravates vata.
Like a roller coaster, because it does that.
Even that, a roller coaster will aggravate vata. You ever notice, like, if you get off a roller coaster, partially because of the fear factor, fear that it produces, the excitement that it produces, and also the actual motion of it. When you come off, you feel like invigorated and a little bit dizzy, and they're all signs of aggravated vata. So yes, roller coasters too. Okay. Fast moving vehicles. There you go. Or falling off of any one of these can also cause an aggravation of vata.
They make it look like a lot of things.
Yes. So what it does is it causes the vata to fill up the channels of circulation, which are either empty or have become weak due to quality, weakened quality due to the lack of unctuousness or drying. That is the dhatu kshaya part. Okay? The vata produces different kinds of ailments, either affecting the whole body or a part of the body. Okay? So sometimes it can be localized or sometimes it can be generalized. Okay? So how do we know that vata is aggravated? What are the functions? What are the first signs that you start to see before it gets to the point where it can produce a symptom or gets to the point where it's producing an effect? You start to notice that vata is aggravated by its functions. The hyperfunctioning of Vata. So for instance, dropping here means like the lack of integrity of a structure. So for instance, your hands have a certain structure and you have control over it. If you have you seen these conditions where like the hands drop, this is how they describe it, or in Sanskrit, it's your hands drop or your foot drops and you don't have the control over it to the same elasticity or movement. That's one, again, what happens when there's excessive vata. There's lack of integrity of the tissues and flexibility. Expansion, like bloating, example. Obstruction, like for instance, again, like the difficulty in breathing, that's an obstruction. Weakness of the body parts, tearing pain, basically all kinds of pain tends to be associated with vata. Okay? Specifically, you know, which types of pain are purely vata. You ever notice that you feel I've seen people say this when in certain types of abdominal disorders or conditions. They feel like something torn inside. Or pricking pain, that's a pretty common one, like the pins and needles. Horripilation is like when your hair stands on end, but sometimes in an abnormal way, so like you tend to feel really cold, you get horripilations. Goosebumps, but too often. Thirst, of course, rigidity, again, stiffness. Squeezing pain, it feels like, again, something's constricting, squeezing, constricting. Tremors, that's a pretty common one. Misery or dull discomfort, like again, like you got up from sitting for a really long time. You feel something uncomfortable or you feel a little bit of stiffness, but it's not very clear what's happening. That's sort of an initial stage. Constricting pain, again, like for instance, in the cases of constipation or the premonitory signs of Ashas, where they feel like they want to go, but it's not coming out. Like they're getting this urge, but nothing's coming out. It's not being able to push through. That sort of constricting pain. Dryness, of course, loss of sensation or numbness in certain areas. Of course, then numbness. Hollowness, you feel something kind of feels empty. Has anyone ever heard that? Like sometimes some people come to me and actually say that I feel like my bones are hollow. Or I feel, yeah, I've heard, have you guys heard that? No. I've heard this expression before. I feel like my bones are hollow. I feel like there's nothing there. Yeah. You've heard that. Yeah, I've heard it too.
Usually I migraine a lot when I would take medication. And the ones that just make me really sick were just like, I feel like a shell.
Yeah.
Very weird.
Yeah. It feels like there's nothing there. It's just an emptiness.
But enough of something that you know that there's nothing there. It doesn't feel like it's blissful. Nothing at all. It feels like
contractions, unnecessary contractions, throbbing pain in the body, that sort of thing. Astringent taste in the mouth, and a blackish, reddish discoloration. So we know about the colors associated with the doshas, the blackish, reddish, sort of like the bruise color. That's a typical vata color. Okay. So that's what happens when you get the abnormal functions. So now this description here is all of the conditions that are purely vata in nature. Okay, so these are known as vata vikaras or also the nanatmaja vyadis. Remember we talked about this, where we talked about diseases that are of one dosha or diseases that are of multiple doshas. So this is an example of the diseases of one dosha. These are the 80 disorders. So you've heard of this 420 before. Yeah. Now I have listed it for you. And if you want to know the ones that picked up, Osha Posha. It is the shloka after this. but Ashtanga Sangraha you guys may not have, but you can find it in Ashtanga Vidya. I'll get the reference for you. But they have, so these are the orders of Vata, where it indicates it's purely Vata. Okay? So now when I tell you the 80, 40, 20, now you'll know what the 80 actually are, what the 40 actually are, and what the 20 are. Okay? So let's go through quickly. What are the 80? I know it was a long list. Even typing it up, I was getting tired. It was massively long. Okay. Nakabeda, cracking in your nails. Cracks on the feet, vipadika. Pain in the feet, any type of pain in your feet. Ptosis of the feet is the same as the drooping, falling of your feet, which you keep drooping. Suktapa, the loss of sensation in the feet or numbness. Vata kudada, which means again a different type of pain. It's sort of like a twisting pain. Is pain and stiffness in the ankles. So is this all starting like, oh, this, yeah, I can do this. Is it starting to make sense now after all this massively long classes that I've made you go through? Now, if I tell you this, look like, oh, right. Makes sense now. Okay. There's a reason for all this torture. So twisting pain in the calves, restless leg syndrome, not a new thing, by the way. It's written right here. Sciatica, again, for the most part, a purely Vata condition. There are certain cases, even in the purely Vata condition, it falls under either one. It is a Vata predominant condition. It's Vata activated either due to that or Vata activated either. But even that sciatica is a condition. And we'll talk about that in a little bit more detail. Cutting pain in the knee joint. So cutting pain, all sorts of pain in the knees, weakness of the thighs, stiffness of the thighs, lameness of both legs in the sense that it's difficult for a person to walk or to move, if you like sometimes they're dragging their leg. Rectal prolapse, that is again a purely Vata condition. Pain in the rectum, testicular regression syndrome, which I didn't realize that was the actual term until I looked it up. Well, it just says that the testicles go back inside. So I looked up, like, what is that? And then I got a name for it. So it's called testicular regression syndrome. Also a Vata condition. Placidity of the penis, enlargement and swelling in the groin, which kind of seems like a prostate issue. Pulling pain in the pelvis, loose stools. Do you want me to say the Sanskrit words? I can say them. Okay, yeah.
We'll go back to the school.
Loose stools? Yes.
How is it
Yeah, you don't have to.
I'm sorry, I didn't get that. What?
Number 21, how is it that peristalsis works?
Reverse peristalsis, where there is upward movement of Vata. There are conditions where Vata moves upward. It can cause, instead of things moving downwards, like regurgitation or like reflux. Reverse peristalsis.
Well, a lot of like SIBO right now, you know, the small intestine bacterial overgrowth, like cecum, which is where the small intestine enters the large intestine, but it starts to creep back up into the small intestine. So that's
Yeah,
kind
but not
of
due to muscular.
right. No, it's probably
It is. It is. And that also would be considered as a, so we don't have those terms, but we're looking at the actual